clinical algorithm series, friends. Now we are going to study altered mental status. Altered mental status or coma patient clinical approach. So any patient of altered mental status, we should check initially for vital signs. That is, initial assessment you should make. Airway, breathing, circulation you should check. And if no gag reflex or GCS is less than 8, you should intubate. That is rapid sequence intubation protocol. And IV oxygens, bedside glucose, GRBS. You should also consider naloxone here, initial assessment. So after that, you should inquire about history, and any suspicion of history you should ask. If it is trauma, then spine stabilization and immobilization is important. Immobilization. If there is no history of trauma, then you should suspect infection. If there is suspicion of infection, you should start IV antibiotics and consider steroids. Then do imaging of CT brain. If there is any lesion in CT, neurosurgery, consultation and referral. If there is no lesion, you should do lumbar puncture. If lumbar puncture shows any infection, you should continue antibiotic ICU admission. If there is no signs of infection in lumbar puncture, you should do toxic and metabolic workup. So if there is no infection, should go for toxic or metabolic workup. You should also do ECG and CT. If it shows any toxic or metabolic etiology, you should treat accordingly. And if there is no toxic metabolic involvement, then you should do CT. If it is showing any lesion, you should neurosurgery reference and consultation. And then consider lumbar puncture if there is no lesion in CT. If it is hemorrhagic LP is there, neurosurgery consult and reference. And if there is non-hemorrhagic LP, consider CVA and anoxia, and you should further evaluate with MRI and neurophysician consultation. If there is history of trauma is there, that is cervical spine immobilization is important, and any signs of impending herniation like Cushing's response, that is rise in BP, fall in heart rate and irregular breathing pattern and unilateral blown pupil are signs of herniation, then you should you should go for elevation of head, elevation of head, neurology consultation you should do, and increase the RR if mechanically ventilated, and osmotic diuresis like mannitol 3% in S, craniotomy or ventriculostomy are considered. If there is no signs of herniation, you should do a CT. Then any lesion is there, again neurosurgery consultation should be done. Or if there is no lesion is there, again you should go for toxic or metabolic workup as said previously. Then you should treat accordingly. If it is yes, there is toxic involvement or toxic etiology is present, then if there is no toxic etiology or penile workup not showing anything, you should consider LB and LP lumbar puncture and proceed as said previously. Thank you.